Well, a new home away from home is opening in Indianapolis for seriously ill patients and their families. Fairhaven says out-of-town families often have no place to stay when they're facing a medical crisis. Business of Health reporter KYLIE VELETA has more. KYLIE.
Thank you, Gary. Since 2008, Fairhaven has provided 35,000 nights of free lodging to patients and their families. They've accomplished that by leasing furnished apartments and local hotel rooms. But Ada's Place is the nonprofit's first facility designed from day one with patients and their families in mind. Amanda Milner is the founder and executive director of Fairhaven, and she joins me now to tell us more about Ada's Place. Thanks for being on the show today.
Thanks for having me.
Well, let's talk first about your personal experience. You've faced a medical crisis yourself, and explain how that really opened the door to creating your nonprofit.
Absolutely. Well, I was diagnosed with cancer in 2001, and at the time I had a 2-year-old and a 1-year-old, and I faced many of the challenges that so many cancer patients face. How am I going to support my family while I can't work? Who's going to drive me to treatments? Who's going to take care of my kids? And during that process, it did turn out that I lost my home. But in the midst of it, I was so blessed and so thankful to God and to so many wonderful family and friends who were there for me, drove me to treatments, helped me get a new place to live, and just really supported us through that process. So when I was able to go back to work and was in remission. I'd worked at the cancer center previous to being sick. When I returned to work there at the cancer center, I was meeting patients and families who needed really the very same things I needed, and that was a place to stay near the hospital and just the support and compassion while going through really one of the most difficult times of your life. So it was really a wonderful opportunity for me to give those things back.
And I know previously your nonprofit, like we mentioned, relied on apartments and hotel rooms, but this facility really has been designed for the patients and for their families. So give us an overview of it. Can you tell us about it?
Absolutely. We're so excited. It's many years in the works. And one of the biggest things for us is we wanted it to feel like a home away from home. You know, just giving people that comfort of a place like a home. And there's 12 guest suites. We can have 12 families here overnight. There's warm and welcoming common areas. And then we've got 2 day service rooms in addition to that. And those are places, if you go any night at any hospital, Methodist, IU, downtown hospitals, there are dozens of people sleeping in the waiting room, sleeping next to a hospital bed with a loved one. And so these 2 shower and laundry rooms, they'll allow these patients, these family members to come and get a shower and wash their clothes and enjoy a meal and just be refreshed and strengthened before returning to the hospital. And
I like how the overnight lodging, I think you mentioned it has 2 beds, so the patient isn't alone, but has space for the family too, right?
It does. There's so many situations that people come. You know, you may come with a mother, a cousin, a friend, your spouse. So yes, there's 2 rooms, 2 beds in every room. There's a small kitchenette in the room. Every room has its own bathroom. It's designed really to be self-contained for immunocompromised patients. We've all learned about the importance of that during the pandemic, but these patients are really, they're very, it's really important that they're safe. And so the room is designed to be self-contained for them if needed.
And explain how, it's interesting, Indianapolis, the size of our city and the medical centers we have in downtown Indianapolis. Explain the void that you saw in Indianapolis for healthcare hospitality in general.
Definitely. Well, Indianapolis is home to the state's only academic health center, so that draws people from all over the state and the Midwest and even the country for some diagnoses. So if you look across the country at major medical centers, there are more than 200 healthcare hospitality facilities across the country. But this was really sorely missing in downtown Indianapolis for adult patients. So we are so excited for the opportunity to be able to serve more families and bring some relief to our long waiting list.
And speaking of the long waiting list, in the past you've served about 125 families each year. Talk about how this is really going to help you grow that number.
Yes, we are estimating at the new facility we'll be able to provide overnight lodging to 500 additional families each year, and through the day shower and laundry program touch another 1,000 families each year. So it is really going to make a difference for so many more families.
And I know you're very close to 16 Tech, a new development in Indy, also super close to IU Health Methodist, the Simon Cancer Center. One thing I want to talk about quickly is how it got the name Ada's Place.
Oh, that's a great story. We were looking for just the right place to expand and found this property that is so close and convenient and really perfect. And we're looking to buy it. But when the owner found out about the mission, he very graciously, generously decided to donate the building. And it had always been used for good. And so the only things he asked is that we continue to use it for this mission and that we name it after his father, Ada's Place. So that's where it got the name. And we're honored to serve in his honor.
All right. Well, I know you're open to patients in just a matter of days. So good luck and keep us posted.
Great. Thanks so much.